Hello everyone, welcome. My name is Kweku. I am a pharmacist. In this video, I will be reviewing the medication escitalopram, which is also marketed under the brand name Lexapro. We will briefly look at what it is, the uses, side effects, dosing, the best way to take it, and also stick around to the end as I will review 7 key precautions that I believe anyone taking escitalopram should be familiar with. And as always, quick disclaimer that this review is for informational purposes only and is not intended to be a substitute for medical advice from your physician. So what is escitalopram or Lexapro? Escitalopram is in a class of antidepressants called selective serotonin reuptake inhibitors. We typically call them SSRIs for short. Now, serotonin is a neurotransmitter or a chemical in the brain that plays a significant role in our mood. Now, I must say that I do believe that as much as possible, if the underlying cause of depression can be identified and taken care of, that would be the ideal situation. But it is an inescapable that a lot of the times medications like escitalopram is warranted as a part of the treatment regimen. The precise antidepressant effect of SSRIs is not fully understood, but at a very high level, it involves preventing serotonin from being taken back into the neurons once they are released and thereby enhancing their activity and improving mood. Now onto the uses. Well, there are 2 main FDA-approved uses, that is for anxiety and for depression. There are, however, some off-label uses, which are uses for which the medication has not necessarily been approved for, but shown to be relatively effective. So there is obsessive compulsive disorder, OCD as we call it, panic disorder, premenstrual dysphoric disorder, PMDD as we call it, which is kind of similar to premenstrual syndrome, PMS, but this one tends to be more serious. PMDD causes severe irritability, depression or anxiety, usually about a week or 2 before the period starts. Escitalopram may also be used for social phobia, or sometimes called social anxiety, which is a mental condition in which there is an intense or persistent fear of being watched and judged by others all the time. Now, how to take escitalopram and the dosing. Escitalopram is available either as a solution or as tablets in strengths of 5 milligrams, 10 milligrams, and 20 milligrams. Your doctor may typically start you on a low dose of escitalopram and increase your dose typically after about a week or so if you're able to tolerate it. It's usually taken once a day and it may be taken with or without food. The key thing here is that it may take about 1 to 4 weeks or even sometimes longer before you feel the full benefit of escitalopram, and therefore do not discontinue taking it, say taking it after 1 week you think you are not getting the desired results. On the other hand, also keep taking escitalopram even if you're feeling well or if you're feeling better. Next, we shift our attention to some side effects. And with respect to side effects, I just want to mention that the fact that these side effects are listed doesn't necessarily mean that anybody is going to experience any or all of these side effects. These are potential side effects. So if you're taking the medication and everything is fine with you, you don't need to worry about these things. This is just something for you to be aware of what can potentially happen so you will know how to react to it if it happens. And I kind of group them into different categories. The first set is the gastrointestinal side effects, which affect the GI tract. And these include abdominal pain, constipation, diarrhea, indigestion, nausea, vomiting, and xerostomia, which is basically dry mouth. The next group of side effects are what we call the neurologic side effects. And this may include dizziness, headache, insomnia, and somnolence, which is excessive sleepiness. So you do realize that Lexapro, escitalopram can cause either insomnia or somnolence. So depending on how the medication affects you, that will determine what time of day, morning, or you take it at night or at bedtime. There are also some reproductive side effects, and these include disorders of ejaculation, which could either be a delayed ejaculation or in some people, a complete absence of ejaculation altogether. Erectile dysfunction, orgasm incapacity, where females are not able to achieve orgasm, and reduced libido. I must say though that these reproductive side effects typically cut across most SSRIs, and therefore it is not unique to escitalopram alone. And then some miscellaneous side effects which include fatigue and excessive sweating. And now to the 7 key precautions that I mentioned in the beginning. Number 1 is the risk of bleeding. Caution should be exercised when escitalopram is combined with blood thinners or even over-the-counter pain medications like aspirin and what we call NSAIDs like ibuprofen, naproxen, All these increase the risk of bleeding. So when combined with escitalopram, that increase is potentiated. So caution should be exercised. Number 2 is worsening depression or suicidal ideation. Escitalopram and most antidepressants have been noted to cause worsening depression or even in some people suicidal ideation, especially among teens and adolescents. So if you have a teen or an adolescent that is taking Lexapro or escitalopram, it will be a good idea to pay close attention to any mood changes or worsening depression. Number 3 is avoid an abrupt or sudden discontinuation of escitalopram. This may result in withdrawal symptoms, which may be characterized by irritability, agitation, nausea, dizziness, and in some people, a burning sensation or even worsening mood changes. Number 4 is watch out for a phenomenon called serotonin syndrome. Serotonin syndrome at a high level involves the accumulation of too much serotonin in the system, and this may result in a lot of issues, the most significant of which is a rapid heart rate and a dangerously elevated blood pressure. Some people may experience diarrhea, headache, heavy sweating, and even shivering. So these are some of the signs to look out for, and if you experience any of them, it will be a good idea to seek medical attention. Number 5 is as much as possible to avoid taking alcohol while you're taking escitalopram. Among other things, taking escitalopram with alcohol concurrently causes, increase in drowsiness. You become less alert and less coordinated. And in extreme cases, taking escitalopram with alcohol has been associated with people becoming violent. Number 6 is to avoid activities requiring mental alertness or coordination until you know exactly how escitalopram affects you. As we've discussed earlier, escitalopram, it may impair judgment, thinking, and some other skills. So knowing how your body reacts to the medication before you engage in any of such activities would definitely be a good idea. Number 7, also be on the lookout for mania or hypomania, which are conditions both characterized by feeling excited or feeling very elated, high energy. If this happens over a prolonged period, it will definitely be a good idea to have a discussion with your doctor about those episodes. So a high level overview of escitalopram. I hope you found some value in it. If you did, please give it a thumbs up, and thank you so much for staying through. I will catch you on the next video.